Hello, everybody, and welcome this afternoon to our first meeting of the City of York Outbreak Management Advisory Board. And I'd just like to thank anybody who's joining us and watching live, but equally thank all of the board members, whether councillors representing particular organisations from the health sector, or those representing other sectors such as transport, community voluntary sector, businesses. Your time is much appreciated, and obviously this is the first meeting of quite a few that we're going to have over the coming months on a set of obviously really important topics for the City of York. So an agenda has been published and everybody's had an opportunity to see that in advance. The first item is a welcome and an introduction, which I've just given. And obviously, when Ian Floyd introduced the terms of reference and membership in a little bit, hopefully that will explore the role of this collection of people moving forward. Second item is apologies from absence. I've got two to note: Health Watch York and North Yorkshire, and also York and North Yorkshire LEP. So if we could record that in the minutes, and I hope that they'll both be able to join us next time. The third item is declarations of interest, but before I ask anybody if they have those, just to record for those watching that in the minutes of the meeting, and obviously all future agenda items, we'll make sure that we record who is on the board, so the names that you can see up on your screen now, and what organisations or sectors they represent, and hopefully it's also clear to you who we all are from looking at the webcast. If anybody has any declarations of interest, if you could indicate through virtually raising your hand, and then obviously I'll know to bring you in at the right moment, but I can't see anybody indicating, so I'll take from that there are no declarations of interest to record. The first substantive item is the terms of reference and membership for this group. I'll go to Ian Floyd first, and then I think bring Sharon Schultz in on this item. If anybody wants to raise a question or make a comment, again, if you raise your hands virtually, and then I'll bring the right people in at the right time. Ian.
Thanks, Keith. I think just to give a quick overview, and obviously I hope the paper is fairly self-explanatory in a sense, but clearly the government has announced a rollout of NHS test and trace programme, and with that, councils who've got responsibility for the statutory public health function have been asked to lead this local approach. The government see the setting up of a local outbreak management board is really quite key in terms of it having engagement, clearly, of elected councillors, but also, as we've got to tonight, a number of key partnership agencies that will contribute to the whole test and trace delivery. So the document sets out the purpose in terms of what the board would do, and you'll see that includes issues such as public engagement, working with different agencies. The communication is a key aspect in terms of what we need to do as well. And clearly, as we're doing tonight, it being accessible to residents who can watch and can seek assurance in terms of what the council and other agencies are doing to support the whole test and trace. So we'll come on to later on in terms of communication, because that is key. Clearly, Sharon has a particular role in terms of her being the statutory DPH. We set out in the paper the issues in terms of decision making, so you'll see there that decisions of the board are purely advisory, and any recommendations need to be considered through the specific governance arrangements of the bodies who are represented. We've set out the frequency, the quorum in terms of the actual decision making is covered there. And clearly, in a sense, it is really to help inform, help to provide that assurance, work with different sectors, so that we have got an effective mechanism linked to all the different other aspects of work that we do, linked to other existing partnerships that we already have got established, to really just support the process of ensuring the most effective response to the test and trace. And I'll stop there. Sharon might want to add something else.
Thank you, Ian. Sharon, anything to add?
Just to add, really, Appendix 1 in the terms of reference just really tries to illustrate for members of the board and other interested parties that this board doesn't exist in isolation. Clearly, because this is a pandemic response that we're talking about, many of the programs of work are done jointly between the council and the Vale of York CCG, with colleagues in North Yorkshire and across the Humber Coast and Vale integrated care system as well. So, and that's really important to have an effective partnership response. So the groups listed in Appendix 1 doesn't capture all of those meetings by any means, but hopefully just gives an illustration of the some of the complexity really of the different levels that we need to be engaging with. But then all of that should funnel itself down to this board as the place-based board in terms of outbreak management for York. But we'll need to ensure we have effective communication out to these other groups as well. And there are some of the members of this board and members of these other forums as well. So it will help with that kind of dynamic communication, which is going to be so important.
Thank you very much. So in a sense, the terms of reference and the membership are for noting for us. I can't see anybody else indicating to speak. So what I'll do is say that we've successfully noted them. If for any reason on this item or future ones you're not happy with the content, do raise your hand, because I'll try and avoid, in a sense, formal voting with our hands in the air. But if anybody ever has any particular issues or wants to raise an item, please do. So we will note the terms of reference and membership, and a little bit like both Ian and Sharon said, I suspect that some of these will change as time goes on and we move through the period of recovery. Item 5 is an overview of the current situation, split into two sections. There's an update from City of York Council, and then also any updates from partners. And I'll hand back to Sharon, and I believe some slides will pop up. Thank you, Sharon.
Yes, so we've changed the order slightly in the way that we're going to present these items, I think, in that whereas the overview was going to be the overview of the Outbreak Management Advisory Board, the test and trace, the York picture, we decided that it made sense to start with the York picture first, and the local epidemiology, as it says there. So I think, Fiona, did we agree that you were going to start off with the York picture and the epidemiology first, and then we would go into the objectives of test and trace, etc.?
Yeah, that's right. So I hope everyone can see the slides on the screen.
I certainly can.
Yeah.
What we can see is this one that's up on the screen is the Outbreak Management Advisory Board, not the epidemiology slide pack.
So I'll just move through the slides. Apologies, my screen seems to have frozen. So I have the slides up and I can't seem to move through them.
What you sometimes do is you stop sharing and then share again. It will just nudge it into life.
I think I'll do that.
The wonders of technology.
Yeah.
It's in the same place.
Yeah, it's just not moving through the slides, unfortunately. I will have one final go to do this. Okay.
If it doesn't work on a third attempt, Fiona, what you can do is to do it verbally, and we can add the slides to the minutes of the meeting.
It's
Although
worked.
it's fixed.
Yeah.
It's worked now, but I'm not sure whether I dare to go on slide view or whether that will kick it into.
I can see it quite clearly, and we can attach. What we can also do, as I said, is attach the slide pack to the minutes.
Yeah.
And so if any residents want to have a closer or better look, they can do that in their own time.
Okay, all right. So I'll what I wanted to do then was to just give an overview of the data that we have relating to cases, numbers of people in hospital with COVID, deaths, and then also care home outbreaks, and really plotted against a timeline so that you can see how the course of events has played out in York. And then I want to give a bit of an overview in terms of some of the limitations of data, and then look towards what it would be helpful for us to monitor going forward so that we can understand how the situation is being managed in York. So looking at the data first then, and looking at the dark blue line that you can see, this shows the number of cases. So as you can see, we had a steady increase in cases up until the end of the first week in May, where we had a peak of 98 cases in a period of a week. And then since that peak, we've seen a steady decline. But what I need to explain is that this is what we call Pillar 1 data. So people who access Pillar 1 testing are generally NHS workers and their family. So if you remember, we went into what we term as a lockdown on the 23rd of March. And so in terms of those cases in Pillar 1, so for NHS workers, you can't really see any impact in the number of cases. And that kind of makes sense, really, because the people working in the NHS, although they might have been having fewer contacts outside of work, they were actually still working in a high risk environment. So as the number of people coming into York Hospital to be treated for COVID, which is the red line on the graph, increases, so do the number of Pillar 1 cases. And we saw that the peak in our residents in York Hospital at the start of May, when there were 81 patients. And again, that's steadily been declining since then. So then looking at the pink line, which is deaths of York residents, fortunately, many people that were admitted to hospital did recover, but you can see a similar pattern in the rise and fall in deaths with the red line, with a peak in early May, when on average there were 36 deaths over the period of a week. Then I want to just draw your attention to the yellow line along the bottom, which plots how many of our care homes in York had outbreaks of COVID-19. Again, this peaked near the start of May, where we had 17 of our homes, that's 46% of our care homes in York, who had outbreaks. Now, this is important because we now know that almost half of the deaths in York were of people living in residential care home settings. So just in terms of those key impacts, 462 cases, but remember that's only a small proportion of cases going through the Pillar 1 testing. The rate of cases, so that is the number of confirmed cases per 100,000 population, was lower in York than other areas of Yorkshire and Humber, and also in England. Again, just comparing that Pillar 1 data across the different areas. Tragically, there were 156 of our residents that have died from COVID-19. This is fortunately lower than the rate in England, but we did have a higher rate in care homes. So it's important to note that this data doesn't tell us anything about the rate of infection in the wider community in York. So when we look at the impact in terms of age, gender and deprivation, when we're looking at those deaths impacted on our older population more in York. The gender breakdown was similar to England, and what we've seen nationally is that deaths have occurred more in deprived areas. So you see the health inequalities coming to the fore. We haven't seen that in York. It's been the middle deprivation quintile that has had the most deaths. But then I take you back to that point about almost half of our deaths occurring in care homes. So that's likely to account for why we have seen that. Also nationally, there's been a lot reported about the impact on the Black, Asian and minority ethnic groups. We haven't been able to do that analysis in York in terms of deaths because ethnicity isn't recorded on that mortality data. So then just looking at recovery and also the test and trace and planning for second waves. So 130 patients have been recovered and discharged from York Hospital. The National Test and Trace programme went live on the 28th of May. So this is where we start to get a bit more of a feel for what's happening in the community. So to date, we know that 56 residents had a positive test since the 28th of May. And of them, 43 residents engaged in the National Test and Trace programme. And this led to 65 contacts being identified, of whom 38 have been contacted and then given the advice to self-isolate. We have now got data for Pillar 2, which is those people who go for a test at either one drive-through centres or order a home testing kit or are tested in a care home. So some of the work that we'll be doing next is to look at monitoring some of those indicators and looking at the Pillar 2 data as well. So the data that we have access to has changed and continues to change. So that first graph that I showed you is what we can track back now and look at. So it's important to say we didn't have all of that as live data as we were going through the pandemic. We've been adding to that as we get it. We have made a commitment to be open and transparent with the public about what data we have and what the picture is looking like in York. So we have indicated, we have published those indicators there on the slide on the York Open Data platform. And as we get access to more data, we'll look to share that on that platform as well. Obviously, there is a downside in sharing data in that these are just numbers. They don't always give you the full picture. We do publish on the open data platform about some of the caveats that are associated with the data, and we do hope that people look at that and take it into consideration. But it's probably just worth running through some of those. So I think one of the first things to say is to not necessarily get fixated on the number of cases. It tells you who's had a test that has come back positive. It doesn't really tell you about the spread in the community, and what we've learned about the virus as we've gone through is that there are a lot of people who don't have symptoms, so wouldn't go for a test. So it's important to bear that in mind. As we do get Pillar 2 data and we know more about the number of tests that are being carried out on York residents, it's probably going to be more useful to look at the proportion of tests that come back positive rather than the number of tests carried out per se. And what will also be useful going forward is to know if tests are being completed and the results being reported back in a timely way. Because it's by knowing quickly that someone is infected, being able to isolate them quickly and then identifying and isolating any of their contacts that will break the transmission of the virus. And it will also be useful to know if we get point where we are identifying cases where there's no obvious source of that case, because then that will give us an indication that perhaps the contact tracing isn't working as well as it might do. I guess conversely to that as well is that if we know how many new cases come from people that we had already identified, this will show us that the contact tracing is working. So monitoring some of those indicators will be important. In terms of the data on deaths that we have, what we have been doing, as well as looking at numbers, is also looking at the number of deaths compared to what we would normally expect at this time of year, and just keeping an eye on that as well. So I hope that that gives an overview of what has happened to date, but also where we need to focus in the future.
Thank you very much. And are we now going to your bit, Sharon?
Yes, unless there are any initial questions
if
that
there
people
are,
might have on the data.
You'll have to stop screen sharing so I can see the raised hands button. So Alison.
Hi, Fiona. You mentioned that we don't have details of the ethnicity because that data is not recorded. It doesn't quite sit right that we just dismiss that. So is that something that going forward we're going to be recording? Because we know nationally there's been quite a lot of interest in that because of the disproportionate number of BAME people being affected.
Yeah, so I think that issue has been raised nationally. So you know, it's how death data is recorded. So it is a national issue that we would escalate up to see if we can get access to better data on that, or else, you know, look to see what we can do at a local level. But often it's, you know, better to raise these things nationally so that we can get a resolution to that. But certainly it's something that we know is important, and so we want to be able to understand the picture more for those communities.
Thank you. Certainly, I'd quite like us to be able to use this board as a way of flagging up those issues where actually, in order, in essence, for the council and the Director of Public Health to do their job properly, what do we also need in terms of information, support and guidance nationally, like access to that Pillar 2 data an awful lot quicker. I'd certainly be very happy to include that point and make some representations on it, because it does seem a gap if you can compare by area, gender and age, but not by ethnicity. So very happy to pick that up outside of the meeting. Any other questions for Fiona at this point? I can't see any, so we'll hand back to Sharon to carry on through the presentation.
Okay, thank you. So just in terms of the national overview then, and thinking back to the terms of reference for this board, we really need to be focusing on the NHS test and trace service. Just to give a bit of an overview of that. The test and trace service is just one strand of an overall approach for managing COVID outbreaks. And while the core element of test and trace is being coordinated through the NHS. There's still a significant role for local authorities and partners to support the overall programme and ensure successful outbreak prevention and management in local areas. So our focus is not just to react to outbreaks that we might have locally, but crucially to work together across the system to put in place measures to try and prevent outbreaks from occurring in the first place. The guidance says that at a local level, the work is led by the Director of Public Health, and every local authority, public health, is a member of the Association of Directors of Public Health and have links into the Chief Medical Officer. So the work that we do locally is very much joined up with that national picture that is led by the Chief Medical Officer as well. One of the requirements, as we've already touched on, is for each local authority area with public health responsibilities to produce a COVID-19 outbreak control plan. All local authorities have outbreak control plans in place already. We are very skilled and experienced at dealing with a range of disease outbreaks such as norovirus or measles. But what's required for COVID is a slightly different outbreak control plan, which is based on 7 core themes that have been given to us nationally. And I'll say a little bit more about them in a moment. You probably have heard from national media that the government allocated 300 million to local authorities to support this work. And we found out last week that York's share of that is £733,896 to support that work. And the formula for distributing that money was based on the public health grant, and there are similar grant conditions in relation to that. So going on to the next slide, and the objectives of test and trace. So the primary objectives are to control the rate of reproduction. So the R rate, as many of you will be familiar with, I'm sure. And that is really the number of people that one person with COVID can infect. So putting in place measures to control that. Reducing the spread of infection, and by that then ultimately saving lives. And it's important to put that within the context of lifting lockdown measures. So if we want life to return to normal and be able to go out to pubs and restaurants, to be able to get back to as normal a life as possible, it's really important that we're able to do that safely. And that's a balance between the risk of infection and the importance of opening up the economy and ensuring that businesses, jobs, etc., are protected as far as possible. So in order to be able to get that balance right, allow York as a city to open up, but to do it safely and prevent the spread of infection, it's absolutely vital that we work together to ensure that we have a local plan and response in place, and that we're working in partnership with the NHS Test and Trace Service in order to be able to identify any particular issues locally and kind of jump on those really quickly and be able to manage those. So going on to the next slide, and an overview of the aims and objectives of our outbreak plan for York. So the overall aim is to provide a framework for the City of York approach to preventing and controlling outbreaks of COVID and reducing the spread of the virus across the city. And so there are a number of objectives we've proposed to help deliver that aim. The first of those is to have a proactive approach to preventing outbreaks from occurring in the first place. And part of that work is to identify where we may have high risk settings and where there are groups in the population that might be at higher risk from COVID. And so some of the high risk settings might be care homes, it might be schools, it might be high risk businesses where it's difficult to put in place social distancing measures, for example. And then we've already talked about Black and minority ethnic groups in the population, older people, people with existing long-term conditions, etc., that might make them more at risk of having serious complications or sadly dying from COVID. So having that proactive approach to preventing outbreaks and supporting people in those particular risk groups. And then, as I mentioned a little while ago, early identification of outbreaks. So that's partly from receiving information from Public Health England as the Biosecurity Centre gets fully up and running. We'll be reliant on them contacting local authority directors of public health with any patterns of having clusters of cases emerging. But also, as Fiona mentioned earlier, using every means at our disposal, really, through working with partners across the York system in responding to early alerts that we might have a rise in cases, whether that's GP practices seeing an increased number of patients contacting them with COVID symptoms, whether it's seeing an increased number of people contacting 111, whether it's schools contacting us with information that they have. So that kind of local intelligence is going to be absolutely key. So as Fiona said, not just relying on the data, but using that local intelligence that we have across the system is going to be key as well, so that we're able to respond to those really, really quickly without having necessarily to wait for somebody to be tested and for there to be a positive test before we respond to that. It's really great that York has been successful in our application for a satellite testing site in York. That will give us capacity for 500 tests a day through that. So that really does open up an opportunity for us to look at wider testing, which is to be welcomed. I've already talked about the importance of comprehensive outbreak management and reacting quickly to quarantine settings in consultation with Public Health England if we needed to. So that might mean localised closures of a workplace or a school, for example. So that's going to be key. And also continuing with the successful work that we've done in York already through the community hubs to be able to support people who need to be isolated. So if people are advised to self-isolate because they've been exposed to infection, it's important that we support those people to remain isolated. And so if they haven't got family support for shopping, etc., and they need help in any way for food or prescriptions or any of those things, it's important that those wraparound support mechanisms that we've had in place up to now continue. And then partly the role of this board is then to ensure that we have the right governance arrangements in place. So there's oversight, check and challenge of the measures that we're putting in place as well. So going on to the next slide then, if you go on to the next one as well, please, Fiona, then I can talk about the themes. So I'm not going to go through these line by line, but just to say that the 7 areas that will need to be reflected in our outbreak plan is how we're going to plan for outbreaks in care homes and schools, those high-risk places that I've already talked about, how we ensure that we have mechanisms in place to ensure testing if we need it. And so York being accepted to be a satellite testing site is going to be really helpful in terms of that. Contact tracing, that's something that we're working on currently with Public Health England around how we are going to do that really successfully in those complex settings. Data integration ongoing, as Fiona mentioned earlier, it is improving, but there's more work to be done for data to be shared that is going to allow us to have a robust local response. So that work is ongoing. How we work as a system and as partners across the system to support vulnerable people, and then, as I mentioned a little while ago, the governance arrangements and the accountability to our population for the plan as well. So going on to the next slide. This is just a quick overview of where testing fits in the national COVID strategy, the governance strategy. So you've heard us talk about Pillar 1. So that's Pillar 1 on the left-hand side, which is the swab testing that's done through the NHS and through Public Health England. We then have Pillar 2, which is the commercial swab testing, the mobile drive-through centres, etc., which we're now starting to see data for, which is welcome. You will have heard a lot on the national news about antibody testing. It's just to say that at the moment, antibody testing is being carried out on NHS staff, and there are some pilots in other areas, but antibody testing is not ready yet to be rolled out to the whole population. And unless Simon knows something other than me, I'm not aware that there's a timescale yet for rolling that out to the whole population. There is a surveillance testing happening in a number of different settings to help improve our understanding of the virus, its impacts, and helping us learn more about the virus and how we protect people. And then there's another strand which is about the national effort around diagnostics and treatments. And one example of that was the announcement of dexamethasone that you will all be aware of from the national news. So that's kind of just a quick overview of where this fits in that national framework. Just a little bit about testing then in terms of our local testing capacity and capability at the moment, which is a key strand in our outbreak plan. So key worker testing is continuing through Pillar 1 of health and care staff. We have our drive-through testing offer at Poppleton Bar in York, and through the LRF, we're also able to access additional testing through the West Yorkshire mobile pilot satellite offer as well. And then, as I've said, we will have our satellite testing site in York. In terms of care settings, we work very closely with Public Health England in terms of managing outbreaks in care homes, and we have a facility to arrange for whole care home testing, and through the Directors of Public Health, we have an opportunity to request testing in priority areas as well. And again, through the LRF, we've been able to explore opportunities to improve the timing of the posting and distributing of swabbing kits and getting those testing results back. So all very positive in terms of that. More work to do, but certainly a better system than there was even a month ago. Things are improving on a day-to-day basis. So going on to the next slide then, which is a bit of a busy slide, but this is really an attempt to try and show the governance structure and showing really how complex some of the relationships are. But if we just focus for a moment on the box at the top, which is the Outbreak Management Advisory Board, so this board has a link into the Health and Wellbeing Board and into the Humber Coast and Vale integrated care systems in terms of the health and care system, but also has a link into the North Yorkshire LRF as well in terms of that wider partnership relationships with North Yorkshire and other partners, including the police, fire service, etc. This board then has a clear relationship with the COVID Health Protection Board that I chair. So we have a Health Protection Board established already, and there will be a core membership of that board that is forming our COVID Health Protection Board. And then underneath that, we have an operational group, which is an outbreak prevention and response group, which will act as the hub for bringing all of those different strands in the outbreak management plan together. It's safe to say that a lot of this work is already happening. This isn't about, we're not starting from a blank page. We've been working in a shared system already since March as part of the outbreak response. But with the establishment of the advisory board, it's just to try and help people to understand how some of those linkages are working, and that governance assurance process and where decisions are being made. And I'm sure this structure may have to be reviewed as we go along, but it would be interesting to have partners' views on that when we get into the discussion. Going on to the next slide then, in terms of the delivery model, at the moment we're assuming that we're going to be focusing on implementing the outbreak delivery plan for anything up to 18 months. It might need to be longer. So our plans need to be flexible in terms of the length of time they need to be in place for, and they need to be flexible to respond quickly to a surge of cases if we needed to do that. And so our central wheel, the hub, services management, and that test and trace hub is going to be key. That hub will link into the COVID Health Protection Board, and then a link into this advisory board. So there will be a dynamic process to quickly alert the wider system if we needed to mobilize surge capacity, for example. And in terms of the timescale, you probably can't read it because it's quite small writing on the left-hand side. The aim is to have the outbreak management plan published in June. We're aiming for a draft plan to be published by the deadline of this Friday, the 26th of June, but to recognise that it is going to have to go through an approvals process, and so there will probably be updates that will be required to that plan, which will remain a live document, but we will have published something in the public domain to meet that timescale of Friday. Going on to the next slide then, there is going to be a self-assessment at Humber, Coast and Vale level, and Phil Metton may want to say a little bit more about that later. But this is our initial self-assessment for York that we've done as an internal public health piece of work at the moment. And as you can see, we're broadly on track. The red area we have is around data and systems needed for local surveillance. And so the question, are you confident you have the data and systems needed to undertake local surveillance? I've said that they are improving, but as DPH, I still do not have full confidence that we have the right data being shared and the right systems needed locally to undertake local surveillance. So that's a risk area that we are clearly going to be focusing on, but a lot of this is outside of our control. And so, you know, the board may wish to make other kind of act as an advocacy role, I suppose, across the system about how we're able to improve that data sharing. So going on to the next slide, we've mentioned some of these uncertainties as we've gone along, but I'll highlight them here. So we know we've had a share of the 300 million that the government allocated for outbreak response. But as of this moment, we don't know over what timescale that money's been allocated. So we don't know whether this is for this financial year, whether it is for next financial year, and whether it's the only money we're going to get for outbreak control plans going forward. So there's an uncertainty over that funding, which makes it a little bit difficult to plan for how we need to use that money. So that's one quite important uncertainty. We then know that the Joint Biosecurity Centre is established. It's in the process of being established. It issued some information about the R rate that was published in the national media earlier today. I haven't had a chance to examine that properly yet, so I'm not able to brief you about that unless someone else in the meeting is, but obviously that's something that we can discuss at future meetings. But as of yet, no useful data has been shared locally. The national app, since these slides were written, obviously the Secretary of State has announced that the app that was being developed is now on hold. They're going down a different route for that, so there is no timescale for that. So that's an uncertainty. And we're still working with Public Health England about how confidential data will be shared around cases in York to support local contact tracing. So that's work that is ongoing as well. And as Fiona illustrated earlier, even though we are now getting some Pillar 2 data through, it's still not really in a useful format. And so there are still concerns around that, even though it is improving. There's still further work to do around that. So going on to the next section then, I'm not going to say much about communication because Claire is going to pick that up later on in the agenda. I'll just say something here about, in case those of you are wondering what SOPs are. So SOPs are standard operating protocols. We have those protocols now in place jointly with Public Health England, and we are reviewing whether we need to localise any of those, and they will be set out in our outbreak plan. So quite a lot of work has already progressed on those since this slide was written. We're not receiving any information from the Department for Education on schools reporting, and you know, Amanda may want to say a little bit about that later on, about how locally we're able to share timely information about any cases and outbreaks emerging in schools. And even though the plan talks about local lockdowns, it's still not clear to local authorities how we would implement that. So if we needed to close or quarantine a school or quarantine a workplace, it's still unclear what powers local authorities have to do that. And so we're waiting for further clarification on that. And then obviously we can look back, but it's difficult to look forward and predict what future scenarios we might be looking at in terms of a second or third wave of the virus and any peaks. So our outbreak plan needs to be planning for the worst, so that we have that surge capacity identified, that it can be mobilized quickly if we need it, and to be prepared for all scenarios, really, without being, you know, without having a crystal ball right now to be able to say what they are. So going on to the next section of the presentation then, Fiona's just going to help you put that, what we've talked about, in kind of by applying a real scenario to some of the work that we've been doing up to now in care homes. But before that, Keith, it might be that one or two people want to ask questions.
Yeah, thank you, Sharon.
Comments so far.
So I think I got a bit muddled with the changing presenter. So apologies, and we'll take notes for future meetings on that. So on agenda item 5, there was the opportunity for partners to give updates alongside the slides that Fiona presented. So apologies for missing that. If you did want to say anything on behalf of your organisations, do flag it at any point during the future agenda items, and I'll bring you in. Obviously, we had quite a lot of information there from Sharon on agenda item 6 about the draft outbreak management plan, and do raise your virtual hand if you want to come in and make a comment. A couple of things for me. I think it will be really important to bring the published local outbreak plan to our next meeting in this forum, which is going to be in about 3 weeks' time, where obviously we'll have all had a chance to look at the work Sharon and her teams have done on the actual plan. The bits that jump out to me are the bits that Sharon highlights as uncertainties or amber and red risks in terms of the work that they've done on the local outbreak plan, so around data, and we all will know the concerns around test results and how slow they were and have been in care homes in particular, about Pillar 2 data, and also not the non-sharing of test results, for example, those from Poppleton Bar, and how unless we get that data and the right data, it's almost impossible locally through the local outbreak plan to do what we need to do. And then the other bit is exactly that, around the governance around any local or regional lockdowns, and what the actual situation is with that. So I'd suggest that we wrap those 3 things in around data, governance, and also that earlier point around ethnicity data, and include that in some representations that we can make up to the local resilience forum, to Leeds City Council, who are the pilot council in our region, and also the Department of Health, in order to do the job that we've got here. But I will start going around with some questions. So the first hand up was Julia.
Thanks, Keith. I had a number of questions on those topics that you've just articulated, so I won't go over those. But I suppose it's the police have some limited powers around enforcement. The question really is around that sort of, how do you enforce a lockdown? What constitutes a lockdown? And also there are some inherent risks around that. So I was contacted, for example, by the Cabinet Office, who were exploring the impact on critical service delivery. So if you've got somebody who's been in contact with somebody who's infected, and it wipes out a whole critical service delivery team, how do we manage that? It also has implications for business as well. So businesses might just be getting up and running, and then all of a sudden they're going to have to be self-isolating, and particularly in the hospitality sector, upon which York is so reliant. How can businesses actually make sure that they can put in some practical measures that will help minimise some of the consequences of that? And I think there's some good practice from other places who are a bit ahead of this in other countries around how, for example, restaurants are managing their bookings and all of the rest of it. And I suppose it's that sort of practical advice. We all want to keep safe, but we all also want to keep things going as much as we can.
Thank you very much. What I'll do is I'll take the next 2 hands, and then I'll come back, Sharon, if you could pick up the different points that people have made. Charlie.
Thank you very much, Keith. Looking at the outbreak control plan, Sharon, high risk places, number 2. Well, we're hoping that close to 20,000 students might reappear at the University of York in September. York St John hopes for another 7,000 more. Obviously people from different places, some of them, many of them we hope, international. That sounds to me like a high-risk location or a high-risk community. It barely features in the government words. I know it features on your outbreak control plan that universities require special consideration, not least when it comes to contact tracing, because we will be a complex setting. And I'm rather concerned about that, because we will need to have a very swift testing capability so that contacts can be traced quickly. Otherwise, it could be a very rapid process of extending through the university, with people in self-isolation, not knowing whether they have anything or not. So my question ultimately is whether the testing capability that we will have through the various sources is really up to the challenge of bringing 20,000 people from different places in the UK and beyond together, and managing the complexity of all of that. And if not, what can we do as a university or as universities to supplement that testing capability?
Thank you very much. And Mark?
Yeah, I think, I guess my question probably relates to, all the stuff that you've outlined in the plan, interventions that need to be made if the picture locally doesn't develop the way we all hope to. But actually, I'm probably asking the question there for the positive stuff. So actually, what you said in the beginning, the York picture is better than the national picture, yet we are adhering to the same kind of national interventions that exist. So, for example, don't use public transport, which is clearly something that I'm interested in. And so therefore, I think it would be good to understand where's their scope within the local outbreak management plan to provide positive interventions that may not be aligned to the national picture. If that makes any sense. So could you, based on a positive development, low infection rate, and so on, locally, actually take further steps that you might not be able to take in other locations in the country because the picture isn't quite the same?
Sharon?
Okay, so if I take the last point first, because I think Julia's is probably the most difficult question, so I need to think a little bit more about that. Absolutely, there is scope for us to do things differently in York if, as a city, partners together say, we're able to do something that Manchester or London and Birmingham wouldn't be able to do. There's nothing stopping us from doing that. As long as we cover the themes in the outbreak plan, how we implement that is very much up to us. And this is why we were keen to have the membership of this board broader than just the NHS and the council, but to have other partners on board, because people from business and other sectors will have some really good ideas around that. And it's a good point that is made, because one of the reasons we think York did so well is because actually we had very good adherence to those lockdown measures. So when we measured our progress against mobility, use of public transport, to what extent people were going out and about from the Google mobility reports, and then compared that with other areas, we can see that by and large, the York population were very sensible about some of those decisions they were making. And so the communication about how people can get back to normal, but get back to normal safely, is going to be crucial to this. And so the role of transport, businesses, etc., is going to be absolutely key to that. And through this board, hopefully what we will get is lots of innovative ideas for how we can do that as a city. So absolutely up for that. In terms of the universities, Charlie, we are going to need an outbreak plan for York St John, and we're going to have an outbreak plan for University of York for the reasons that you've already highlighted. And so even though we'll have the overarching plan, we have got those standard plan, those joint framework agreements in place with PHE, and there is one for schools and university settings, particularly for University of York, because of the number of students and, you know, the challenges of your campus. We will have to work with you and involve Public Health England in this as well, in terms of having an outbreak plan for the university, so that as a university you're assured that you know, all of the partners that you need around the table, everybody knows who they are, everybody knows what has to happen if we have to press the button to go, and that we can escalate that really, really quickly. So absolutely take on board the comments that you've raised, and we'll want to work with you on that. Julia's point then, I think, is a really difficult one. And this is why, for me, getting the local surveillance system and the data sharing mechanisms in place locally is going to be so important, because no one will want to make a decision to go into any kind of localized lockdown. That would be the last resort. You would hope that the prevention measures we've got in place, the local surveillance systems that we've got in place, are robust enough to give us an early warning of you know, a hotspot of infection emerging, and that we would be able to respond very quickly to be able to manage that and contain it before we ever got to the point of needing to close down somewhere. That certainly is my aim. And I will say that, you know, our outbreak plan, you know, one of the measures of success would be how quickly we're able to respond and contain that, and never get to that point where, you know, we're needing to use legal powers to be able to shut things down. I would see that as a very last resort. The risk then is around that data and that local surveillance system, and how robust we can make that so that we are able to respond quickly. And that, to me, is key to being able to open up the city, you know, to allow everything to get back to normal, for businesses to be able to open. That is absolutely key, which is why I kind of, Keith knows, I keep banging on about that, really.
On that point as well, Sharon, whether you could almost draft something on behalf of the board, picking up those points around data systems and governance, because I do think they are important points to make. Is that something you could do? And then we can see if there's general, offline of this meeting, general support to send that before the next meeting.
Yeah, yes, I can take that as an action.
Thank you. I was just going to say, I'll bring Julia back in, and then I'll bring you in, Danny. I can see you've indicated. Julia.
Yes, sorry. So Sharon, I just don't want to lose the point about practical support to business. So I was talking to a friend of mine who happens to own a restaurant, and she was sort of thinking, well, what, you know, how do I manage my bookings so that I know, for example, where every individual is sat in my restaurant, so that if there is a requirement to identify people who've been there, that can be done really quickly and easily. And I think businesses are just crying out for that practical help and ideas. And I suppose it's how do we support them, because they want to do the right thing, because they desperately want to trade, but how do we provide them with that practical advice?
Yes, and that is something that is on my to-do list. The barrier to that at the moment is our capacity to be able to do that. And so with the government money we have to support the outbreak, one of the priorities for that is to expand our capacity both within the public protection team, environmental health officers who are very skilled at going in to advise businesses, within the public health team, public health analyst support, comms support, so that we can increase capacity to be able to really target those things that we think is going to make a huge difference to us as a city. And you're absolutely right. And we're already having businesses contact us for advice. We've done some support in that in terms of packs that have been sent out to businesses with leaflets and information. But I am very aware that written information goes only so far, and that there will be businesses that will need some hands-on support to do their risk assessments and then the practical advice, as you say. So there's every intention to do that. I'm working as quickly as I can to try and get more capacity within the team to be able to do that. But you're absolutely right. It's an important priority for us.
I think the thing to add to that, in addition to the signage and business toolkit that Sharon mentioned, that obviously was released to coincide with the start of the opening up to retail, and we've committed to produce a similar pack specifically when you get the leisure and hospitality sectors opening up in a few weeks' time, and we're waiting for a little bit of information from the government on the licensing regime. And as soon as we've got that, we'll be able to put that further support and a more specific pack in place for those different business sectors. And certainly there's that ongoing commitment to review it and to keep providing that support as the situation changes over the days and weeks to come. Danny.
Thank you, Chair, and thank you, Sharon and Fiona, for your presentations. I've just got a brief question on the outbreak control plan around theme 1, where we've got a great deal of public interest and sometimes concern, of course, around care homes and schools. And I'm really looking for you to explain or outline the risks potentially of trying to get a universal approach throughout those two sectors. We know that in York they're disparate, and there are many different operators, if you like, trusts and companies in those two sectors. But in the interests of fairness to residents in the city, we're looking for a universal approach that says, if you've got a child going to school, or if you've got a relative in a care home, that they're not going to be at greater risk because of the relationship that partners around this board or the local authority have got with the different companies or trusts that are operating. So could you just outline how we're going to go about getting that universal approach, which of course we will all know is much needed and sought after?
So I will leave care homes, because Fiona's going to talk in a little while about some of the work that we've done with care homes. I don't know whether, Amanda, you want to say something about the approach that we've used for schools, which seems to have worked very well up to now, that we'll be seeking to build on as we get into the kind of next stage of implementing the outbreak plan? Would you probably know more about the specifics of what's happened with schools?
Amanda's indicated, so happy to bring you in.
Evening, everybody. Yeah, the approach that we're taking with schools will be the approach that we've taken right the way through, because it is important to remember that schools have been open throughout lockdown. They've been open for particular groups of children. So we've worked very closely together with York Schools and Academies Board to take a city-wide approach to how do we make sure that everything we do is based on risk assessments and is based on absolutely most up-to-date information that we have available. So public health team have worked incredibly closely with us, with all of the head teachers and with the chief execs of the multi-academy trusts, as well as our maintained heads. And as you'll know, the approach to opening of schools is different in each school, because it depends on the physical building that they've got available to them. It depends on the teaching staff that they've got available to them. And that is unlikely to change. You know, we will continue to work with each of our schools to make sure that they've got individual plans to take us through the next stages of whatever happens next. So we are working on what September looks like now, and we're working on a range of different models around what September looks like. Obviously, we don't have the central guidance, but the central approach that we're taking will be exactly the same. It'll be based on risk assessment and what we can do based on the most up-to-date science that's safe. We haven't had, we've been very lucky, haven't had any outbreaks that have been linked to schools across the city. So, you know, that's been really positive. And members of the school community and the education community have very, very proactively used public health advice. So I think the point that Sharon made in terms of getting in to make things as safe as possible before you get to the point of an outbreak has been really, really important. So lots of advice and support to settings around when to use PPE, how to use PPE, how to effectively intervene in a whole range of different scenarios. And I think that close working with public health is something that we need to continue going forward.
Thank you very much, and hopefully Fiona will cover the specific point on care homes under the next item. I'm just quickly checking, and I can't see any other raised hands. So again, in that sense, when we're noting progress towards a local outbreak plan, noting the fact that it will be published to meet the government's deadline, but that published plan will then come back to this outbreak board as we continue to respond, and equally picking up those points, particularly around data that will communicate higher up and nationally, so that we can do everything we can do to respond. So that takes us on to agenda item 7, which is around case scenarios, and back over to Fiona and the slides.
Right, I haven't got any slides for this. It was just a verbal update, really. Great. And the reason really was to just try and make it a little bit more real. We've talked about the plan and the sort of theory of how this would work. So I just wanted to just spend a little bit of time just telling you a little bit about the work that we've done with care homes, and how we've kind of got from that position where we had 17 of our care homes with outbreaks now down to just 3 with current outbreaks. So in practical terms, and it picks up the point that you made, Councillor Myers, about how we have that uniform approach. So our colleagues in adult social care have daily contact with every residential care home within York, and in that sort of morning call that they do round to those care settings, the care homes will report on a number of issues to them. So they'll let them know if they've got any of their residents who have symptoms. They'll discuss any other concerns that they might have. That might be around having low stocks of PPE. It might be that they've got a lot of staff absences. It might be about the best way of cleaning, or that they're worried about their sort of cleaning regime in the home. So there's a number of sort of things that the staff in adult social care will talk through, and they'll gain an overall picture of what's happening within that care home and any support that the home is asking for. Then in the afternoon every day, colleagues from adult social care who've done that call and ring round in the morning will have a discussion with our colleagues from the CCG that link in with a team that physically go in and provide support to every care home, and also ourselves in public health. And we'll have a discussion to discuss all the intelligence that adult social care have got from that morning call, all of the intelligence that's coming back from the CCG visits. And what we do is we RAG rate all of the homes in terms of, you know, how we think they're doing and any concerns that have been raised. And then also, we will have a discussion about whether there are any homes where we feel that there are issues going on, whether it's because they've got symptomatic residents or if they've got cases where we think it would be of benefit to do whole home testing of all the staff and all the residents within that care setting. And then every morning at 8 o'clock, we have what we call a care home gold meeting, which is on the footprint of the local resilience forum. So it's colleagues across North Yorkshire and York, and we have adult social care, Public Health England, the CCGs, CQC, and the infection prevention control team there. So we have all the partners on that call where we run through all of the issues in the areas and we decide and allocate the resource. So whether it's we need the infection prevention control to go in and give support to that care home, whether it's the CCG team who do the training, whether they need to go in and do a visit into the care home, or whether there's a home that we want to put through for whole testing of that site. So on that sort of partnership discussion, we determine where the resource needs to be prioritized and allocated, and that is for every residential home in York, whether it's private, council run, that covers all of them. So it is resource intense, and it can work because our colleagues in adult social care already have good existing relationships with all of the homes, and for a place like York, you know, it's a relatively small number of homes. But this kind of approach is what we need to build on when we're looking at whether it's schools, whether it's workplaces. So there's something about having that single point of access for other settings. And we also need to be able to ensure that we've got the resources if a setting does raise a concern. So whether that's being able to get support around infection control measures, whether it's advice around PPE, we need to make sure that we've got enough resource to provide that same level of advice to the other settings. And then I think the important thing is that we need to take a preventative approach to all of this as well. So the National Track and Trace programme will obviously tell us if we have confirmed cases. But what we're doing in the care homes and what we should be aiming to do within the other settings is having that intelligence when places are identifying actually we've got people who are symptomatic, so even before a test result comes back, and also identifying early where our high risk settings are, so that we're not kind of playing catch up afterwards. So it's taking that proactive approach to identify those and build up the kind of relationships and communication with those settings prior to any outbreaks happening. And then the other point that was raised as well is about ensuring that we have the testing capacity. If there were, as you say, like the university or another workplace or any other setting, if we did need to do testing of that site, to make sure we've got that capacity available. So obviously we're not going to have contact with potentially every setting where an outbreak might happen. So the other route that's important with all of this as well is around the work that we do with our colleagues in the health protection team in Yorkshire and Humber. So obviously, if cases are identified through the National Track and Trace programme, the other route into all of this is when that's being dealt with as a complex outbreak through the health protection team, and we will work closely with them. So if it were a setting that we weren't aware of, didn't know what was happening, we would then be involved once the health protection team are made aware of that. So those close working relationships between our two teams obviously important. So as Sharon alluded to, we're building up a team within the local authority with public health, but also how do we link in with our colleagues, for example, in environmental health, because they've got a lot of those workplace links, and also building on the relationships we've already got with colleagues in education. And as Sharon said, having those sort of standard operating procedures for all of the settings that we identify, so that we can take that kind of preventative and then early intervention approach when we do have outbreaks.
Thank you very much. Are there any questions or comments on Fiona's update? If there are, if you raise your hands, I'll pick it up. If not, just a couple of things to mention back to Sharon and Fiona. Presumably outside of the meeting, you'll keep those conversations going with Charlie and colleagues in relation to the different university outbreak plans, and also on Mark's point in particular, picking up in a sense having a York approach to transport. And I know hopefully our next board meeting will be joined by a LEP representative in terms of obviously that contact with businesses, but hopefully you'll be working with them discreetly in terms of feeding into that plan, and then in a sense, if the plan isn't perfect when published, we'll keep working on that with those different sectors.
Yes, certainly. And the plan we publish on Friday will be a draft plan that we're going to continue to work on. And yeah, there's an awful lot of work that's going on to engage with partners outside formal meetings.
Great, thank you. Julia.
Thanks. Just a quick observation. I just know that we've are just about to extend the CSAS powers to the York bid rangers. And I just think it strikes me that they probably have a role to play in all of this as well. And obviously they're not police, but they are key partners in the city centre. And I don't want to think outside of this meeting, we just need to make sure we're linked in with those types of people as well.
Yeah, no, absolutely, and completely agree with that sort of visible reassurance in the city centre, and also help with messaging, whether it's bid rangers, Make It York, council staff, PCSOs, police, is going to be really, really important. So I'm sure Sharon will pick that up if she hasn't already. So thank you for all of that. So I'm going to take agenda items 8 and 9 together, which is the draft communications plan, and then any questions and requirements on communications. So I'll hand over to Claire, who I think is going to present some thoughts. Thank you, Claire.
Thank you. So we've been working on sharing safety messages, obviously, about the outbreak since it started, if not just before. If you could move on to the next slide, please. Thank you. So recent examples of things that we've done that you may have seen include we've introduced several new ways of communicating safety messages to different audiences. You'll know that during a crisis, you're supposed to communicate at least 10 times more. So we've set ourselves that challenge. We've introduced Facebook Ask the Leaders questions. And if I just give you some examples of numbers. So the last one we had, which was about schools reopening safely and about safely reopening the city centre, we reached over 5,000 people, had 1,700 views all the way through and 163 comments. And those comments are, of course, questions that people were asking residents. We've introduced little safety videos, which Fiona very kindly does for us. This one is about, that you can see on the screen, is actually about updating advice for the shielded. The most recent one we've released is about face coverings, and that came out this week, or sorry, just the end of last week, and that reached 1,140 people and had 225 views all the way through. So we know that people are using and share and absorbing safety information in different ways, whether they engage with it through conversation in the Facebook Ask the Leaders, or they get kind of updates and practical information from public health colleagues. Next one, please. Thank you. Most recently, you may have seen this. This is our Let's Be Safe campaign, which is really all about opening up the city, whether that's opening the city centre, opening toilets, opening parks, whatever it is, it's opening something. We've got a series of city centre signs that have been put up that support our one-year transport plan around opening up and changing public space to make it safer to walk through the city centre. And then obviously a series of social media posts, working with partners on supporting them put up posters and information, whether through Yorkshire Museum Trust or with the business packs that Keith mentioned earlier. To give you an idea, the Let's Be York video has been viewed 51,000 times. It's had 551 likes and been shared 95 times. So that's been really positively received. Social distancing social media posts, which is one of the most recent ones we've issued, was shared and reached 3,493 times. The business packs, we've provided 1,000 free packs of information to businesses, and we're updating that for pub pack for the hospitality industry, which we'll be launching towards the end of this week, hopefully, depending what happens on the 4th of July. We are sharing local resilient forum messages and government messages, and regularly have introduced members and partner updates which go out twice a week, resident email updates that go out twice a week, children and families and business bulletins which go out once a week, and then between every 2 and 3 weeks we do a direct mail to all households, which provides either up-to-date guidance from the government and more public health safety messages, just to make sure everybody knows what to do and how and when they can do it. So that's kind of ongoing activity that will keep going. There's just some examples of the local resilient forum social media posts that they've provided us with and that we share regularly alongside the ones that they share as well. Thank you. Next slide. Thank you. So our communications plan for the Outbreak Control Advisory Group meeting is very simple. It's basically build advocacy, so share as many messages as we possibly can to as wider networks as possible. Build confidence in the steps the city are taking to keep everyone safe and what people need to do to keep themselves safe. That's work that we've started, and we'll just keep that going, and of course ramp that up or down according to what the latest government guidance is. And then build engagement through conversation. So the Facebook Live sessions are part of that, as is our big conversation, which is launching this week and is a citywide consultation around all sorts of things to do with recovery, but also what is it that will help residents feel safe. And then if we can move on to the next one. This is just to give you an example of the types of activities that we'll be doing, everything from promoting the webcasts that we're now making just right now, to demonstrating how partners are engaging and building that advocacy, to making sure we talk about the preventative approach. We share the data, so case data is very important. I know already, I've just seen on Twitter that Chloe has shared that on the press, so it's literally live and hot off the press as we speak. And just make sure that we are really clear to as many different audience groups as possible how to keep safe, how to stay safe, and the steps that we're taking to be safe. If we go on to the next slide. This just gives you an example of the different types of things that we'll be doing, the different tasks we'll be doing, and the different audience groups we'll be doing it with. It's important to state, really, we're taking a phased approach. So we're in phase 1 now, and we have been since the start, really, which is all about sharing current safety messages and public health messages and the guidance as it changes and adapting that for the current situation. Phase 2 will be around publicising and promoting the actual plan itself, which will be sort of end of June, early July time, and the steps that people can take and the actions that will be taken to make sure we can help keep the city safe, whether through outbreak management or hopefully preventative measures. And then after that, from sort of August and things start opening up more widely, it will be making sure that we're clear on what the new or what the changed safety messages are and how we can make sure that they still stay current with people and they're not getting tired of seeing social distancing messaging, for example, and starting to maybe drift closer together. So that's our, in a nutshell, and just conscious of time, our communications and engagement plan for the next 3 months, I guess. Very happy to take questions.
Thank you very much for that. Are there any questions or comments either in terms of the draft communications plan or any particular suggestions you or your organisations have? Because I certainly think picking up that last point is there's going to be a really ongoing challenge of getting the public health guidance out there, particularly at a time when things start to come back, and what resident expectations might be of what, for example, the police or the council can do versus occasionally the reality of how far those powers will stretch. I'll go to Julia.
So I think this is a really fundamental shift in communication strategy. So in the past sort of 12 weeks, it's all been about enforcement. So it's all been, you're allowed to do this, you're not allowed to do that. If you don't do this, this will happen to you. This is fundamentally different. This is a sort of education campaign around how you take responsibility for keeping you and your loved ones and your fellow citizens safe. I suppose I don't know how you sort of acknowledge that. It is a really big difference, I think. So we've had a lot of calls into the control room, as you can imagine, with people saying people aren't socially distancing, you need to go and enforce it. Police saying, sorry, we don't have any powers around legislation to enforce social distancing, and members of the public then feeling let down, if you like, because action hasn't been taken to enforce that social distancing, because there's an expectation that has been set up that this will be enforced. So I suppose and I know I certainly the Chief Constable feels very strongly about this, that this is a public health crisis. It is not a policing crisis. And the way that the police have been catapulted into all of this as the enforcers of all of this sits really uncomfortably with us, because actually this isn't about enforcement. It's about keeping ourselves safe. And I just wonder how you can work with NYP communications to try and make that transition more obvious, because I think there will still be that expectation that somebody's going to say, no, you're not allowed to do that, and here's a ticket.
Yeah, certainly.
Yeah, Claire.
Sorry, so the Let's Be Safe campaign is all about basically taking personal responsibility, and we say let's be safe, let's be welcoming, let's be considerate, let's be York, in a kind of way of really spelling out those kind of behaviours that we would expect people to demonstrate when they're in York, whether you're a visitor, a resident, a student, or whatever. We have been working with partners to share those messages and to get it out there, and you can see we've been relatively successful by the figures that have seen the video. But I take your point. We can talk to North Yorkshire Police colleagues, Janice in the communications team, and talk about and really look at how can we bridge between what has been a very hard stay home, stay safe, otherwise the police will come and get you message, to what has sort of transitioned almost overnight to stay alert, and what that actually means for personal responsibility. So yeah, happy to take that away, very much so.
Certainly, I'd be really keen to see as consistent as it can be messaging and advice across police, council, health sector, particularly as we begin to see, as you say, that challenge of people expecting the police or different agencies' trading standards to be able to step in when perhaps the reality that they can't, versus the situations where they can. So it'd be great if, Claire, you could see a way of doing that. Andrew.
Hi, I just wanted to share a few points and thoughts, really. Firstly, I'm mindful of how much work public health has done in this. It's a lot of work and a lot of answers and certainty that people are looking for. And I just want to caution the board, really, because the kind of certainty people are looking for is zero risk. This does not exist. And I think, Amanda, you said it rightly earlier, it's all about the risk assessment going forward. I'm just a little bit worried that we get overly hung up on SOPs because protocols work fine for things that are standard, but this is a very new pandemic still. So whatever we create has to be a living, iterative document going forward. And on the last bit, coming back to that staying alert and creating a new safety norm, I think it's important that all of us here acknowledge that this isn't just public health's role, this is everyone's role. Because we need to get out that change in behavior across the city, across all parts of the city, really, across all organizations, including health. And I'm sure Phil will want us to say this, the NHS, we're here very much to support our local council colleagues and other sectors as well in whatever response going forward.
Thank you very much. Claire, anything you wanted to add?
No, that's great. Thank you. That's been valuable feedback. Thank you.
So that takes us on to the next item. But I remember Sharon mentioned at the start whether Simon, you wanted to say anything after Fiona's presentation. So just wanted to give you the opportunity to come in if you wanted to.
Oh, thanks. No, I think it was a very comprehensive run through of the epidemiology and some of the challenges around things we've discussed at length, like data collection and data quality and data sharing, which are not small challenges to overcome by any means. So I don't think I do have any specific points on that, but just in terms of my overall comments, I think it's a really positive. I think the whole thing should be viewed in the way that some of the more recent comments have been made, in that it is about personal responsibility and seen as a proactive approach that all people can take part in. If it becomes too much about zero risk and absolute guarantees that nothing will ever happen, it will only ever fail. But if it is seen as positive and people working together in some of those comms messages, then it will be much, much better, I think. Because as Andrew was saying, you can't really, this whole thing, it's still evolving and it is very challenging throughout. And if you make it sound like everything is going to work perfectly, then it will only ever disappoint people. So I think that was the only other comment I had, really.
Great. Thank you very much, Simon. So I can't see any other hands, so we'll note Claire's communications plan, and I know that will be a standard item, I'm sure, in future board meetings. And actually, Claire, it might be nice to get some of the partner organisations to come and present some of their ways to getting those shared messages out.
Yeah, definitely. Okay, we can invite someone to the next meeting. That's fine. Yeah.
Great, super. Thank you very much. So it takes us on to agenda item 10, which is just noting future meetings. So in the terms of reference, you'll have seen that there'll be a meeting in 3 weeks' time. So we can actually bring the published plan to the meeting, and then as it stands, they'll then be monthly. But I can vary that. So if at any point a member of the board thinks actually there's a particular topic that we need to have on the agenda, or we need a meeting urgently, just please send me a message, and obviously we can look at that schedule of meetings to make sure that we can give that assurance, in a sense, that we're doing everything we can do in York. And then the final item is any other business that I haven't been told there is any, so hopefully this is the point where people don't raise their hands and throw in last things. But just to say thank you very much for the work that I know has gone into the presentations, the slides, and for all of you to give your time to be part of this board. It's much appreciated. Thank you very much. Have a good evening. Bye bye.
Thank you.
Thank you. Cheers.
confirm that the